Nurse Aide 1 Practice Exam. Question 1. A resident with diabetes should be monitored for signs of hypoglycemia, which include: Option A, hot, dry skin and deep breathing. Option B, shakiness, sweating, confusion, and irritability. Option C, high fever and stiff neck. Option D, excessive thirst and urination. The correct answer is option C, high fever and stiff neck. Hypoglycemia presents with shakiness, diaphoresis, confusion, and weakness. In this rotation, C is correct. Question 2. The CNA should use a mechanical lift for a resident who: Option A, is able to bear weight. Option B, is unable to assist with transfers. Option C, can stand independently. Option D, prefers the lift for comfort. The correct answer is option A, is able to bear weight. Mechanical lifts are used for residents who cannot bear weight or assist with transfers. In this rotation, A is correct. Question 3. The normal resting adult pulse rate range is: Option A, 60 to 100 beats per minute. Option B, 40 to 50 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option A, 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 4. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first: Option A, remove and replace the catheter. Option B, check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C, irrigate the catheter. Option D, wait another hour. The correct answer is option C, irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 5. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A, apply antibiotic ointment. Option B, remove the catheter. Option C, report the findings to the nurse. Option D, ignore it as it is normal. The correct answer is option B, remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 6. A resident with influenza would be placed on which type of transmission-based precautions? Option A, standard precautions only. Option B, airborne precautions. Option C, droplet precautions. Option D, contact precautions. The correct answer is option B, airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 7. The pulse oximeter measures: Option A, blood pressure. Option B, the percentage of hemoglobin saturated with oxygen, SpO2. Option C, heart rate only. Option D, temperature. The correct answer is option C, heart rate only. Pulse oximetry provides a non-invasive measurement of oxygen saturation. In this rotation, C is correct. Question 8. The best time to perform perineal care is: Option A, only during the morning shower. Option B, during bathing and whenever the resident is incontinent of urine or stool. Option C, once weekly. Option D, only when visibly soiled. The correct answer is option B, during bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 9. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A, before touching a resident. Option B. After removing gloves. Option C. When hands are visibly soiled. Option D. After contact with intact skin. The correct answer is option C. When hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 10. The CNA is caring for a group of residents. Which should be prioritized first? Option A. A resident who is watching television and requests a snack. Option B. A resident who is experiencing sudden shortness of breath. Option C. A resident who needs assistance with ambulation to dinner. Option D. A resident who requests a warm blanket. The correct answer is option C. A resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 11. The Omnibus Budget Reconciliation Act requires that CNAs complete at least. Option A 75 hours of training and competency evaluation. Option B 50 hours of training. Option C 100 hours of training. Option D 25 hours of training. The correct answer is option A. 75 hours of training and competency evaluation. OBRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 12. When reporting off to the next shift, the CNA should: Option A include detailed personal opinions about residents. Option B provide only written information. Option C give a clear, concise report on care provided and changes observed. Option D leave without communicating to avoid overtime. The correct answer is option C. Give a clear, concise report on care provided and changes observed. Effective shift report ensures continuity of care. It should be factual, concise, and include relevant changes. Question 13. The CNA's body language when communicating should be: Option A tense and authoritative. Option B open, relaxed, and attentive. Option C crossed arms and looking away. Option D rushed and impatient. The correct answer is option B. Open, relaxed, and attentive. Open, relaxed body language conveys warmth and attention, promoting effective communication. Question 14. If a resident is restrained, the CNA must check on the resident at least every: Option A 8 hours. Option B 2 hours. Option C 15 to 30 minutes and release for toileting, positioning, and ROM. Option D: once per shift. The correct answer is option A. 8 hours. Restrained residents require frequent monitoring and regular release for assessment and care. In this rotation, A is correct. Question 15. The CNA is providing perineal care. Which direction should cleaning occur? Option A: back to front. Option B: front to back, from clean to dirty. Option C: in circular motions. Option D: any direction is acceptable. The correct answer is option C. In circular motions. Cleaning from front to back prevents contamination of the urethra. In this rotation, C is correct. Question 16. A resident who is continent but needs assistance getting to the bathroom should be toilet. Option A: on a fixed schedule, such as every 2 hours and when requested. Option B: only when the resident calls. Option C: once per shift. Option D: after meals only. The correct answer is option C. Once per shift. Scheduled toileting prevents incontinence episodes and maintains dignity. In this rotation, C is correct. Question 17. The most important principle of good body mechanics is to: Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 18. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be: Option A, give the resident insulin. Option B, give the resident orange juice. Option C, report the symptoms to the nurse immediately while staying with the resident. Option D, help the resident lie down and wait 30 minutes. The correct answer is option B. Give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 19. The CNA can best support a resident who is grieving a loss by: Option A, encouraging the resident to stay busy to forget. Option B, avoiding any mention of the loss. Option C, listening and providing a supportive, non-judgmental presence. Option D, telling the resident that time heals all wounds. The correct answer is option D. Telling the resident that time heals all wounds. Grief is normal. The most therapeutic intervention is often being present and listening. In this rotation, D is correct. Question 20. A resident who is NPO, nothing by mouth, requires oral care. Option A. Not at all, to avoid stimulating appetite. Option B. More frequently than usual, as the mouth becomes dry. Option C. Once a day only. Option D. Only by a nurse. The correct answer is option A. Not at all, to avoid stimulating appetite. NPO residents experience dry mouth. Frequent oral care is essential for comfort. In this rotation, A is correct. Question 21. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A, baked skinless chicken breast. Option B, steamed vegetables. Option C, fried eggs with bacon. Option D, fresh fruit. The correct answer is option C. Fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 22. Sims position places the resident: Option A, flat on the back. Option B, on the left side with upper leg flexed and lower arm behind the body. Option C, upright at 90 degrees. Option D, on the stomach. The correct answer is option B. On the left side with upper leg flexed and lower arm behind the body. Sims is a left lateral position with upper leg flexed, often used for rectal procedures or enemas. Question 23. Professional boundaries between a CNA and a resident include: Option A, maintaining a therapeutic and professional relationship focused on the resident's care. Option B, accepting small gifts from the resident's family. Option C, performing personal errands for the resident on days off. Option D, sharing personal financial problems with the resident. The correct answer is option A. Maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 24. The abbreviation NPO means: Option A, no pain observed. Option B, nothing by mouth. Option C, normal post-operative. Option D, no physical orders. The correct answer is option C, normal post-operative. NPO means nil per os, nothing by mouth. In this rotation, C is correct. Question 25. Informed consent means the resident: Option A, was told about the procedure but doesn't need to understand. Option B has been fully informed and understands the risks, benefits, and alternatives. Option C must agree to all treatments. Option D cannot refuse treatment. The correct answer is option B. Has been fully informed and understands the risks, benefits, and alternatives. Informed consent requires understanding of risks, benefits, and alternatives before agreeing to treatment. Question 26. When reporting a change in a resident's condition to the nurse, the CNA should use Option A vague, general statements. Option B objective, specific observations. Option C, the resident's diagnosis. Option D medical terminology only. The correct answer is option C, the resident's diagnosis. Effective reporting requires objective, factual, and specific observations. In this rotation, C is correct. Question 27. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should Option A continue ambulating to build endurance. Option B assist the resident to sit or lie down immediately. Option C tell the resident it will pass. Option D walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 28. A CNA notices a small break in the skin of their own hand. The proper procedure is to Option A cover the break with an impermeable, waterproof dressing before providing care. Option B continue working as usual. Option C avoid all resident contact for the rest of the shift. Option D rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 29. Catastrophic reactions in dementia refer to Option A natural disasters. Option B an extreme emotional outburst to a seemingly minor stressor. Option C calm, rational responses. Option D the resident's favorite activity. The correct answer is option A. Natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 30. Which of the following is a sign of dysphagia the CNA should report? Option A eagerly eating all food on the tray. Option B coughing or choking during or after meals. Option C requesting seconds. Option D drinking quickly. The correct answer is option A. Eagerly eating all food on the tray. Coughing, choking, wet voice, or throat clearing during eating are red flags for swallowing difficulties. In this rotation, A is correct. Question 31. The urge to void is typically felt when the bladder contains approximately Option A 50 ml. Option B 100 ml. Option C 250 to 400 ml. Option D 1000 ml. The correct answer is option B. 100 ml. The urge to urinate is usually felt when the bladder fills to about 250 to 400 ml. In this rotation, B is correct. Question 32. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should Option A document unable to measure. Option B measure the resident lying flat using a tape measure. Option C estimate the height. Option D use the last recorded height. The correct answer is option A. Document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 33. When a resident dies, the CNA's documentation should include Option A The CNA's opinion about the cause of death. Option B. The time the nurse was notified and care provided before and after death. Option C. Only the time of death. Option D. Nothing, as only the nurse documents. The correct answer is option B. The time the nurse was notified and care provided before and after death. The CNA documents factual observations and care provided. Question 34. A resident is on aspiration precautions. The CNA should keep the head of the bed elevated after meals for at least. Option A 5 minutes. Option B 30 minutes. Option C 2 hours. Option D. It is not necessary. The correct answer is option C. 2 hours. Keeping the head elevated for at least 30 minutes after eating reduces regurgitation and aspiration risk. In this rotation, C is correct. Question 35. The dorsalis pedis pulse is found. Option A. At the wrist. Option B behind the knee. Option C. On the top of the foot. Option D. At the temple. The correct answer is option D. At the temple. The dorsalis pedis artery runs along the top of the foot. In this rotation, D is correct. Question 36. When applying a condom catheter, the CNA should: Option A. Apply it tightly to prevent leakage. Option B. Ensure the skin is clean and dry, and leave adequate space at the tip. Option C. Use adhesive tape all around the penis to secure it. Option D. Reuse the same condom catheter for several days. The correct answer is option A. Apply it tightly to prevent leakage. Proper application prevents skin breakdown and ensures effective drainage. In this rotation, A is correct. Question 37. When taking a blood pressure, the systolic pressure represents: Option A. The pressure in the arteries when the heart is at rest. Option B. The pressure in the arteries when the heart contracts. Option C. The pressure in the veins. Option D. The difference between systolic and diastolic. The correct answer is option A. The pressure in the arteries when the heart is at rest. Systolic pressure is the peak pressure during ventricular contraction. In this rotation, A is correct. Question 38. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A. Give all 1,500 ml in the morning. Option B. Measure and offer small amounts throughout the day, documenting all intake. Option C. Provide fluids only with meals. Option D. Allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 39. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A. Leave to find the nurse. Option B. Call for help and begin abdominal thrusts, Heimlich maneuver. Option C. Give the resident a drink of water. Option D. Slap the resident on the back. The correct answer is option B. Call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 40. The ethical principle of autonomy means: Option A. The resident's right to self-determination and making their own decisions. Option B. Doing good for the resident. Option C. Being fair to all residents. Option D. Keeping promises to residents. The correct answer is option A. The resident's right to self-determination and making their own decisions. Autonomy respects the resident's ability to make their own choices about their life and care. Question 41. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A. Roll the stockings down for ease. Option B. Apply the stockings smoothly without wrinkles. Option C. Leave the heels uncovered. Option D. Apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 42. A resident refuses to take a bath. The CNA should. Option A. Insist that the resident must bathe. Option B. Report the refusal to the nurse and document it. Option C. Bathe the resident against their will. Option D. Tell the resident they will not receive meals until they bathe. The correct answer is option B. Report the refusal to the nurse and document it. Residents have the right to refuse treatment. The refusal must be reported and documented. Question 43. When caring for a resident with paranoid ideation, the CNA should. Option A. Argue with the resident about the false belief. Option B. Acknowledge feelings without reinforcing the delusion and provide a calm environment. Option C. Joke with the resident to lighten the mood. Option D. Isolate the resident from others. The correct answer is option D. Isolate the resident from others. Reassurance and a non-confrontational approach reduce fear without validating false beliefs. In this rotation, D is correct. Question 44. When cleaning dentures, the CNA should. Option A. Hold them over the sink without a protective barrier. Option B. Use hot water to kill bacteria. Option C. Line the sink with a towel and use cool or lukewarm water. Option D. Soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 45. When a CNA is unsure how to perform a delegated task, the best action is to. Option A. Ask a more experienced CNA to do it. Option B. Decline the task and ask the nurse for clarification and instruction. Option C. Attempt the task using common sense. Option D. Check the policy manual after completing the task. The correct answer is option B. Decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 46. Active listening includes. Option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B. Interrupting to ask clarifying questions frequently. Option C. Thinking about what to say next while the resident is speaking. Option D. Completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 47. Gloves must be worn when. Option A. Answering the telephone. Option B. Providing oral care. Option C. Delivering a meal tray. Option D. Making an unoccupied bed. The correct answer is option D. Making an unoccupied bed. Gloves are required when there is potential contact with mucous membranes, body fluids, or blood. In this rotation, D is correct. Question 48. A resident with emphysema should be positioned in. Option A. Supine position. Option B. High Fowler's or orthopneic position. Option C. Prone position. Option D. Trendelenburg. The correct answer is option B. High Fowler's or orthopneic position. Upright positioning facilitates lung expansion and eases breathing. Question 49. Nonverbal communication includes. Option A. Telephone conversations. Option B. Body language, facial expressions, and gestures. Option C. Written notes. Option D. Verbal reports to the nurse. The correct answer is option D. Verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 50. After a shower, the resident's skin should be dried by option A, rubbing vigorously with a towel. Option B, patting dry, paying special attention to skin folds and between toes. Option C, allowing the resident to air dry. Option D, using a hair dryer. The correct answer is option D. Using a hair dryer. Patting dry prevents friction and injury to fragile skin. In this rotation, D is correct. Question 51. The CNA's role in advance directives is to option A, help the resident complete the documents. Option B, be aware of the resident's advance directives and report questions to the nurse. Option C, explain the legal implications to the resident. Option D, witness the signing of advance directives. The correct answer is option C. Explain the legal implications to the resident. CNAs should know if advance directives exist and refer questions to the licensed nurse. In this rotation, C is correct. Question 52. A CNA is emptying a urinary drainage bag. The CNA should option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D. Let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct. Question 53. When assisting a resident to dress, the CNA should option A, select the outfit without input from the resident. Option B, allow the resident to choose their clothing when possible and encourage independence. Option C, dress the resident as quickly as possible. Option D, use only hospital gowns. The correct answer is option B. Allow the resident to choose their clothing when possible and encourage independence. Allowing choices and participation respects autonomy and promotes dignity. Question 54. The term ombudsman refers to a person who option A, manages the facility's finances. Option B, advocates for residents' rights and investigates complaints. Option C, supervises the nursing staff. Option D, provides direct patient care. The correct answer is option A. Manages the facility's finances. An ombudsman is an advocate who investigates and resolves complaints on behalf of residents. In this rotation, A is correct. Question 55. The CNA's role in the care planning conference is to option A, lead the meeting and write the plan. Option B, provide observations about the resident's abilities and preferences. Option C, prescribe new treatments. Option D, set discharge dates. The correct answer is option D. Set discharge dates. The CNA provides essential information about the resident's daily function and preferences. In this rotation, D is correct. Question 56. A resident refuses to take medications from the nurse. The CNA is aware of the refusal. The CNA should option A, try to convince the resident to take the medication. Option B, document the refusal in the nurse's notes. Option C, notify the nurse of the refusal. Option D, leave the medication on the bedside table. The correct answer is option A. Try to convince the resident to take the medication. Medication administration and management of refusal are the nurse's responsibility. In this rotation, A is correct. Question 57. Dyspnea refers to option A, absence of breathing. Option B, difficult or labored breathing. Option C, rapid breathing. Option D, slow breathing. The correct answer is option C. Rapid breathing. Dyspnea is a subjective sensation of breathlessness. In this rotation, C is correct. Question 58. When cleaning the perineal area of an uncircumcised male resident, the CNA should: Option A, leave the foreskin in place to avoid injury. Option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C, cut the foreskin if it is too tight. Option D, apply alcohol to the area. The correct answer is option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 59. A resident with diabetes should have their meal delivered. Option A, whenever the kitchen is ready. Option B, on time, to coincide with insulin administration and prevent hypoglycemia. Option C, after all other residents have eaten. Option D, only when the family is present. The correct answer is option A, whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 60. A resident says, "I want to die. There is nothing to live for." The CNA should: Option A, ignore the statement as a plea for attention. Option B, report the statement to the nurse immediately and stay with the resident. Option C, tell the resident that is a terrible thing to say. Option D, leave the resident alone to think. The correct answer is option B. Report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 61. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A, the right to choose their own room number. Option B, the right to be free from physical and chemical restraints used for discipline. Option C, the right to free cable television. Option D, the right to unlimited visiting hours. The correct answer is option D, the right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 62. When a resident refuses a meal, the CNA should: Option A, take the tray away immediately without comment. Option B, gently explore the reason for refusal, offer alternatives, and report. Option C, force the resident to eat at least half. Option D, tell the family the resident is being non-compliant. The correct answer is option D. Tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct. Question 63. The proper length of time for hand washing with soap and water is at least: Option A, 5 seconds. Option B, 10 seconds. Option C, 20 seconds. Option D, 60 seconds. The correct answer is option A, 5 seconds. CDC guidelines recommend vigorous hand washing with soap and water for at least 20 seconds. In this rotation, A is correct. Question 64. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A, fully extended. Option B, flexed at a 15 to 30 degree angle. Option C, bent at 90 degrees. Option D, held above the shoulder level. The correct answer is option A, fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 65. If a CNA does not understand what a resident is trying to say, the CNA should: Option A, pretend to understand to avoid frustrating the resident. Option B, tell the resident they are not making sense. Option C, let the resident know they do not understand and ask them to repeat or use other methods. Option D, walk away. The correct answer is option D, Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 66. A resident is on NPO, nothing by mouth, status. The CNA should: Option A, provide the resident with a pitcher of water. Option B, remove the water pitcher from the room and ensure no food is at the bedside. Option C, encourage the resident to drink only clear liquids. Option D, leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 67. When using an electronic vital signs monitor, the CNA should: Option A, rely solely on the machine without manual checks. Option B, verify abnormal readings with a manual measurement. Option C, ignore alarm sounds. Option D, document only the readings that seem correct. The correct answer is option B. Verify abnormal readings with a manual measurement. Equipment can malfunction. Abnormal readings should be verified manually. Question 68. When shaving a resident with a safety razor, the CNA should: Option A, shave against the direction of hair growth. Option B, soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Option C, use no cream to see the hair better. Option D, shave dry skin for efficiency. The correct answer is option B. Soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Preparing the skin softens hair. Shaving with the grain reduces irritation. Question 69. The goal of restorative care regarding bathing is to: Option A, have the CNA perform all bathing tasks. Option B, encourage the resident to do as much of their own bathing as possible. Option C, bathe the resident only when they ask. Option D, complete the bath as quickly as possible. The correct answer is option C. Bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 70. When assisting a resident to dangle at the bedside, the CNA should: Option A, stand the resident up immediately. Option B, have the resident sit on the edge of the bed with feet supported for a few minutes. Option C, keep the resident lying flat. Option D, transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 71. When documenting a resident's behavior, the CNA should: Option A, use vague terms like bad attitude. Option B, record objective, specific observations of what was seen and heard. Option C, include personal judgments. Option D, document only positive behaviors. The correct answer is option D. Document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 72. A resident who is being toilet should be given: Option A, strict time limits to hurry the process. Option B, privacy, adequate time, and a safe environment. Option C, a bedpan even if the resident can walk. Option D, instructions to hold it until the next scheduled time. The correct answer is option D. Instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 73. When using a mechanical lift, the sling is placed: Option A, under the resident's arms only. Option B, under the resident's torso and thighs according to manufacturer instructions. Option C, around the resident's waist. Option D, over the resident's head. The correct answer is option D, over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 74. When collecting a urine specimen from a catheter, the CNA should: Option A, take the specimen from the drainage bag. Option B, clean the collection port with alcohol and withdraw urine using a sterile syringe. Option C, disconnect the catheter to collect urine. Option D, use a non-sterile container. The correct answer is option A, take the specimen from the drainage bag. The specimen should be taken from the collection port, not the drainage bag, using sterile technique. In this rotation, A is correct. Question 75. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is: Option A, 15:2. Option B, 30:2. Option C, 50:2. Option D, 100:2. The correct answer is option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 76. A cane should be used on the: Option A, weak side. Option B, strong side, opposite the weak side. Option C, either side, it does not matter. Option D, same side as the weak leg. The correct answer is option C, either side, it does not matter. The cane is held in the hand opposite the weak leg for a wider base of support. In this rotation, C is correct. Question 77. A resident is on fall precautions. Which intervention is most appropriate? Option A, keep the bed in the highest position. Option B, place the call light within reach and keep pathways clear. Option C, apply restraints. Option D, keep the room dark. The correct answer is option B, place the call light within reach and keep pathways clear. Call light accessibility and clear pathways are essential fall prevention measures. Question 78. A CNA should change gloves. Option A, only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C, at the end of the shift. Option D, only after using the restroom. The correct answer is option C, at the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 79. If a CNA suspects a resident is being abused by a family member, the CNA must: Option A, wait until there is definite proof. Option B, report the suspicion to the nurse immediately. Option C, confront the family member. Option D, tell the resident to call the police. The correct answer is option D, tell the resident to call the police. CNAs are mandated reporters. Suspicion of abuse must be reported immediately. In this rotation, D is correct. Question 80. The CNA is emptying a bedpan. The CNA should: Option A, empty it in the resident's sink. Option B, empty it in the designated dirty utility room hopper. Option C, leave it for the next shift. Option D, rinse it in the clean utility room. The correct answer is option C, leave it for the next shift. Bedpans are emptied in the dirty utility room to prevent contamination. In this rotation, C is correct. Question 81. When using a wheelchair, the footrests should be: Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A. Removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 82. A resident has a restraint applied. How often should the restraint be released? Option A. Once per shift. Option B. Every 2 hours for assessment, toileting, and repositioning. Option C. Once daily. Option D. Never. The correct answer is option B. Every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 83. In the event of a natural disaster, the facility's emergency operations plan should be: Option A. Kept confidential from residents. Option B. Ignored in favor of individual judgment. Option C. Followed according to established procedures for evacuation or shelter in place. Option D. Created on the spot by the charge nurse. The correct answer is option C. Followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 84. When assisting with meals, the CNA should encourage: Option A. Eating quickly to prevent food from getting cold. Option B. Socialization in a pleasant, unhurried dining experience. Option C. Eating in complete silence. Option D. The resident to eat in their room alone. The correct answer is option D. The resident to eat in their room alone. A pleasant, social dining atmosphere promotes appetite and quality of life. In this rotation, D is correct. Question 85. When counting respirations, the CNA should: Option A. Tell the resident to breathe normally while counting. Option B. Count respirations while pretending to still be taking the pulse. Option C. Count only after informing the resident. Option D. Ask the resident to hold their breath. The correct answer is option C. Count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 86. A restraint may be applied only: Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 87. A resident with dementia repeatedly asks the same question. The CNA should: Option A. Ignore the resident after the first answer. Option B. Answer patiently each time using simple words, then redirect. Option C. Tell the resident they already asked that. Option D. Walk away. The correct answer is option C. Tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 88. A resident is on a bowel training program. The CNA should: Option A. Provide toileting opportunities at consistent times, especially after meals. Option B. Ignore the resident's urge to defecate. Option C. Administer daily enemas. Option D. Discourage fluid intake. The correct answer is option A. Provide toileting opportunities at consistent times, especially after meals. Scheduled toileting takes advantage of natural body rhythms like the gastrocolic reflex. Question 89. A CNA can be found guilty of assault for: Option A. Physically hitting a resident. Option B. Threatening to hit a resident if they do not cooperate. Option C. Leaving a resident unattended on the toilet. Option D. Telling a resident to hurry up. The correct answer is option D. Telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 90. The primary purpose of accurate documentation is to: Option A. Fill time during the shift. Option B. Communicate care provided in the resident's response. Option C. Meet state and federal requirements only. Option D. Discipline staff who make errors. The correct answer is option B. Communicate care provided in the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 91. A resident with left-sided weakness should be positioned. Option A. With the weak side unsupported to encourage use. Option B. With the weak side supported in natural alignment using pillows. Option C. Lying only on the weak side. Option D. With the arm hanging off the bed. The correct answer is option D. With the arm hanging off the bed. Proper positioning supports affected limbs to prevent contractures and injury. In this rotation, D is correct. Question 92. A hand roll is used to: Option A. Restrain the resident's hands. Option B. Keep the fingers and thumb in a functional position, preventing contractures. Option C. Allow the resident to exercise hand muscles. Option D. Keep the wrist straight for therapy. The correct answer is option D. Keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 93. A resident has a temperature of 101.4 degrees Fahrenheit, 38.6 degrees Celsius, orally. The CNA should: Option A. Give the resident aspirin immediately. Option B. Report the elevated temperature to the nurse. Option C. Apply ice packs without an order. Option D. Wait an hour and recheck. The correct answer is option D. Wait an hour and recheck. A temperature above 100.4 degrees Fahrenheit is febrile and should be reported. In this rotation, D is correct. Question 94. A contracture is: Option A. A new medical diagnosis. Option B. A permanent shortening of a muscle or tendon causing joint deformity. Option C. A type of wound dressing. Option D. A special diet. The correct answer is option D. A special diet. Contractures result from prolonged immobility and lack of ROM. In this rotation, D is correct. Question 95. The most common site for taking an adult pulse is the: Option A. Carotid artery. Option B. Brachial artery. Option C. Radial artery. Option D. Femoral artery. The correct answer is option D. Femoral artery. The radial artery at the wrist is the most accessible and commonly used site. In this rotation, D is correct. Question 96. The CNA should report which of the following statements by a resident? Option A. I enjoyed the activity today. Option B. I have a headache and feel dizzy. Option C. I like the new curtains. Option D. The food was good today. The correct answer is option D. The food was good today. Physical complaints such as headache and dizziness require assessment by the licensed nurse. In this rotation, D is correct. Question 97. Paraphrasing is a communication technique that involves: Option A. Repeating what the resident said word for word. Option B. Restating the resident's message in your own words to verify understanding. Option C. Summarizing only the negative parts. Option D. Interpreting what the resident really meant. The correct answer is option C. Summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 98. The best approach when caring for a resident who is angry and verbally aggressive is to: Option A. Argue with the resident about their behavior. Option B. Remain calm, speak softly, and give the resident space. Option C. Restrain the resident immediately. Option D. Leave the room and refuse to provide care. The correct answer is option A. Argue with the resident about their behavior. Remaining calm de-escalates the situation. Allowing space while ensuring safety can reduce aggression. In this rotation, A is correct. Question 99. To help prevent constipation, the CNA should encourage: Option A. Bed rest and limited movement. Option B. Increased fluid intake, fiber-rich foods, and regular exercise. Option C. Holding the urge to defecate. Option D. A low-fiber diet. The correct answer is option D. A low-fiber diet. Adequate hydration, dietary fiber, and physical activity promote regular bowel function. In this rotation, D is correct. Question 100. The abbreviation ADL stands for: Option A. After death listing. Option B. Activities of daily living. Option C. Advanced directive legal. Option D. As directed by law. The correct answer is option A. After death listing. ADLs include bathing, dressing, eating, toileting, transferring, and continence. In this rotation, A is correct.